So today we are talking about the digestive system for project number 1 here for the CNA school nursing assistant. So today we're going to be talking about the digestive system, okay, and how it relates to the parts and functions, normal changes while aging, how to take care of the certain diseases and disorders that come with the gastrointestinal system as you age. And as a CNA, how do you take care of a patient or resident with these type of diseases or ailments? So first, I'm not going to get into too much of the anatomy about it, but here's just a little background so you know how the digestive system works. So when we look at the digestive system, it is broken up into 2 subdivisions. The major subdivisions are one, and then the accessory organs. The major subdivisions include the oral cavity, the pharynx, esophagus, stomach, small intestine, and large intestine. So that's basically your major subdivisions. So first of all, as you age, your digestive system is slower to move bowel depending on diet, exercise, personal habits, and medications taken. For example, an elderly resident who has a disorder of fecal impaction is experiencing hard stool that is stuck in the rectum and cannot be expelled. How does a nurse assistant assist a resident with fecal impaction? Well, first we need to report it to the charge nurse. The charge nurse or doctor will insert 1 to 2 glove fingers into the rectum and break the mass into the fragments into the rectum and break up the fragments in order to have it pass. And as the resident is in our care, we would ensure to provide high fiber diets to digest according to the diet and care plan of the resident. Plenty of water, increase the resident's activity level if medically cleared, and doctors would prescribe possible medication. Now, that's just one of the disorders that we are talking about today. So how to take care of that again is report to the charge nurse. The charge nurse will call in the doctor or the nurse, and they will use the gloved hand to insert 1 or 2 fingers into the rectum and to break it up and to allow it to pass. So the major subdivisions of the digestive tract start off with the oral cavity. The oral cavity consists of the mouth and the tongue, and also some salivary glands. These are very important for digestion because you would the bolus would enter here, which is the amount of food, and then it goes to your tongue. Salivary glands, they would secrete the lubrication of the fluid containing enzymes and break down carbohydrates. And then it goes down into your pharynx and esophagus, which transport materials to your stomach. Now, your stomach is the chemical breakdown of materials by acids and enzymes, mechanical processing through the muscular contractions, and then onto your small intestine. So that's part of your tract here, and it goes down to your small intestine, which is the digestion and absorption of water, organic substrates, vitamins, and ions. And your large intestine, this is your small intestine here. Please excuse me. This is the small intestines here. And this is your jejunum, which is responsible for most of the digestion, and the ileum right here, which is the bottom portion of your small intestines. Your large intestines is responsible for the dehydration and compaction of indigestible materials in preparation for elimination out through the anus. So that is your major subdivision of the digestive tract. So another good example of fecal impaction is a real life situation with my mother-in-law. She actually suffers from fecal impaction disorder. So there are disorders versus diseases. We're talking about a disorder at this very moment. So fecal impaction, again, is the hard stool that's stuck in the rectum. So she's about a little bit over 100 pounds. Um, doesn't eat too much fiber or drink too much liquids or water. She doesn't enjoy drinking water. And sometimes fiber is just a little bit too heavy for her, being just a little bit over 100 pounds. And, really watches what she eats and everything. So it is a little tough for her to pass. So there are times where she would have to get the fecal matters removed by hand. So it is a common thing with elderly, and she's about 74 years old. So it is one of those things where if it does happen as a nurse assistant, that we would have to get assistance from the charge nurse or the doctor. Of course, reporting to the charge nurse first. So again, a high fiber diet, plenty of liquids, fluids, an increase in activity level, and possibly medication would be the remedies to that. So one common disease is the esophageal reflux disease, commonly referred as the GERD. And it is a chronic condition in which the liquid contents of the stomach back up into the esophagus. So here's your stomach. It just, liquid contents would back up all the way up to the esophagus. I'm sure when you're pregnant, or if you've ever been pregnant, that you understand how things regurgitate. And it puts pressure on your chest and causes one of the common symptoms of heartburn. So heartburn is the result of a weakening of the sphincter muscle that joins the esophagus to the stomach. And this muscle prevents the leaking of stomach acid and other contents back in the esophagus. So stomach acid causes a burning sensation. It's also called heartburn in the esophagus, and if heartburn occurs frequently and remains untreated, it can cause ulceration. So the heartburn must be reported to the charge nurse. Also, heartburn and GERD are usually treated with medications, so that's definitely something that the charge nurse would have to take a look at first. So in order to prevent from GERD happening, again, that's gastroesophageal reflux disease. In order to prevent that, you serve the evening meals 3 to 4 hours before bed, and providing residents with extra pillows so they can be more upright during sleep, and serving the largest meal of the day at lunch. And throughout the day, they would have just very small portions and very small meals throughout the day to avoid the heartburn. And reducing fast foods, fatty foods, spicy foods can also help. No smoking, no drinking alcohol, and wearing loose fitted clothing are also very helpful when a resident has gastroesophageal reflux disease or heartburn. So another disease with the gastrointestinal within residents who are elderly is also the ulcerative colitis. It is a chronic inflammatory disease of the large intestine. This here is the large intestine. So this here is a normal colon. You can see that the fibers are perfectly nice and smooth. With the colon with ulcerative colitis, you can see that it's a little bit, degenerated there. And then the colon with severe ulcerative colitis looks like this. So it's kind of like deteriorating. It is the chronic inflammatory disease of the large intestine. So it is an itis, which means inflammatory. Symptoms include like cramping, diarrhea, pain occurring on one side of the lower abdomen, rectal bleeding, loss of appetite, and weight loss. So ulcerative colitis is a serious illness with the gastrointestinal that can cause intestinal bleeding and possibly death if left untreated. So medications are the only way that can relieve symptoms, but they cannot cure ulcerative colitis, which is the diversion of waste to an artificial opening or the stoma through the abdomen. So stool is diverted through the stoma instead of the anus. And there is more information on that, colostomy bag and stuff like that, that we can take a look at. So here is the colostomy bag. And as a nurse assistant, we must always wash our hands and carefully wear gloves. We need to help residents with ostomies. And basically, we can empty and clean or replace the ostomy pouch whenever stool is eliminated. Skin barriers protect the skin around the stoma from irritation from the waste products. And barriers may come in the form of powder, gel, cream, ring, paste, wafer, or a square. So we always must use barriers. We need to encourage fluids and a proper diet to the residents and drink plenty of water. Many of the residents feel they have lost control of basically their bodily functions, so they will be embarrassed or angry. We always have to be professional and be very empathetic towards our residents. So in short, basically with your gastrointestinal system or your digestive system, we all must take care of our colons. So it all depends on what we put into our bodies, will determine how we will live our lives after the age of 40. So whatever you do now under the age of 40 will also catch up after the age of 40 and into your elderly years up, 70s, 60, could be 60s too and above. And so again, your transverse colon, your small intestines, everything on here is what controls a lot of the diseases and where it comes from. So a lot of people say they're lactose intolerant, but it really is that lactose does not agree with the adult digestive or gastrointestinal system. It never really did. And for babies, it's been okay because they need the nutrients from the milk and from the mama. But as you get older, nobody is really lactose tolerant. It actually breaks down the tissues of your intestines. So again, please all take care of your colons. Be careful what you eat, and your diet and exercise really plays a major part. That's just a couple of disorders and ailments and diseases that you can come across at being a CNA and nurse assisting in the real world. Again, wash your hands thoroughly, report anything to the charge nurse as needed. And again, lots of fluids, lots of fiber, and your resident should be in good shape. Thank you. So I have read a couple books on clean gut. So I was really into the digestive system and the gastrointestinal at one point, and still am. So after I gave birth to my son in 2019, June of 2019, I was looking to really lose a lot of weight. So this is just on a side note. Basically, I read this book, which is called Clean Gut by Alejandro Junger, Dr. Junger, who is the author of Clean Gut, and he is also the gastrointestinal doctor or internal medicine doctor for Gwyneth Paltrow and Donna Karan. And they have testimonies in this book about what happened with them and how it's healed all kinds of ailments and like weight loss, stuff like that, and just being your overall health and sustainability. So I would definitely recommend this book, even for and because most ailments, they reside in your digestive system, and so that's why it's so important to keep your gastrointestinal very clean. Probiotics, digestive enzymes, and immunity, all of that. I take all the supplements, stuff like that, to aid in, so that way in my 70s I won't be struggling with my gastrointestinal or anything like that. This is another book that he also wrote. It's called Clean and Remove, Restore, and Rejuvenate. So anybody who wants to detox, these are good books for detoxing and weight loss. Aside from that, just your overall digestive health these would be the books to read that I would recommend, but that's up to you.